All right, so are you ready to dive into this?
Let's do it.
Today we're going to go deep on getting back to sports after like a total hip or knee replacement.
That's good.
You know, you sent us this awesome chapter from a medical textbook.
Right.
Chapter 14, Return to Sport Following Total Joint Arthroplasty. Just skimming through it, I'm already like, whoa, so many questions.
Yeah, I mean, it's a really interesting area.
It is.
And, it's really interesting to see how much the whole idea of joint replacement has changed over the years.
It has.
I mean, if you go back a few decades, these surgeries were kind of seen as a last resort.
Yeah.
For, mostly older people who had really bad osteoarthritis.
It was like the surgery no one really wanted.
Right.
But sometimes you just needed it to function.
Exactly. It was like, okay, this is it.
Yeah.
This is the last stop. And the chapter even mentions this fear of loosening. The idea that the implant would fail over time.
Yeah, like your body just wearing it out too fast?
Yeah, exactly. Particularly if you were younger and more active. So surgeons would be hesitant to even recommend it for people who wanted to, keep up a pretty active lifestyle.
Like if you're a weekend warrior, you're out.
Yeah, pretty much. The technology just wasn't there yet. But, things have come a long way.
I bet.
The advancements in, materials and surgical techniques, it's like night and day.
Yeah, how so?
Well, we're seeing much better success rates now.
Okay.
And the implants are lasting much longer, even for really active individuals.
Okay, so that's huge for, anyone listening, right?
Mm-hmm.
It's not this activity-ending surgery anymore.
Right.
It's potentially activity-enabling.
You got it.
So let's kind of break it down, starting with total hip arthroplasty.
Okay.
THA.
Mm-hmm.
The chapter gives a shout out to Sir John Charnley,
Oh, yeah.
like the inventor of the modern hip replacement.
He was a pioneer, really.
Was he like the rock star of orthopedics back then?
Pretty much, yeah. His work back in the 1960s was revolutionary.
What did he do?
So he came up with this idea of a low-friction joint using a metal ball and socket that moves on a polyethylene liner. It was a game changer, but like with any new technology.
There are always kinks to work out.
Right, exactly. And there were definitely some early concerns about, wear and tear and loosening over time.
Oh, yeah, I imagine they were figuring things out as they went along.
Yeah.
So how did they resolve those early issues? Was it just better materials?
It was a bit of both, actually.
Okay.
So material science advanced quite a bit, and they found ways to address those wear issues with that metal on polyethylene combination.
Okay.
But then they also made some design tweaks, just refining things, and that led to much longer lasting implants. And, this has really changed who we consider a good candidate for hip replacement. Now it's not just about age anymore.
It's about your lifestyle.
Exactly. It's about your lifestyle and your goals.
So speaking of lifestyle, the chapter mentions that nearly all patients getting a THA these days want to maintain a pretty active lifestyle.
Yeah.
I mean, that's mind-blowing. But does that also set up some potentially unrealistic expectations?
Yeah, that's a really good point. It's super important for patients to have realistic expectations about what they can achieve after surgery, right?
Yeah.
Because returning to activity isn't just about the procedure itself. It's about, individual factors. It's about rehab, and it's about making smart choices about which activities to pursue.
So it's not like you get a new hip and you can just jump back into running marathons, right?
Exactly.
You need to be careful.
It's more like a careful climb back to activity.
Yeah.
Working closely with your medical team.
So it's a team effort.
It is, absolutely. And the chapter highlights this beautifully with a study. It compared forces on hip implants during walking versus skiing.
Oh, wow. Interesting. So you'd think skiing being higher impact would be worse, right?
You would think so, right?
Way worse than walking around.
But they found the opposite.
What?
Yeah, skiing actually had lower peak joint forces.
Okay, how is that possible?
Well, the thinking is that the gliding motion in skiing kind of distributes the load more evenly, while walking involves that, repetitive, jarring heel strike, which concentrates the force.
Oh, that makes sense.
Yeah.
So if you're an avid skier thinking about a hip replacement, this is good news.
It is good news. But it also shows that those common sense assumptions about what's good or bad for your joint might not always be right.
Right.
So working closely with your surgeon and your physical therapist
It's key.
to develop a personalized plan, it's key.
Yeah.
They can really help you make informed decisions.
Okay, so it's about smart choices, not limitations.
Exactly.
Now, the chapter also mentions hip resurfacing as an alternative to THA. What's that all about? Is that like hip replacement light?
Yeah, that's a good way to put it. It's definitely less invasive than traditional hip replacement.
Okay.
They preserve more of your natural bone, so this makes it really appealing to younger, active people who want to, maintain a higher level of activity.
So it's less invasive, but maybe not as durable.
Yeah, it's a trade-off.
Okay.
And it's important to remember that even with hip resurfacing, a full return to all high-impact sports might not be possible, and it's not suitable for everyone.
Sure.
THA, even though it's a bigger surgery, generally leads to greater reduction in sporting activities compared to resurfacing.
Right.
So it really boils down to your individual needs and what you prioritize in terms of recovery and your activity goals.
So again, it all comes back to that personalized approach.
It does.
And speaking of personalized, there was this really interesting study from 2007 in the chapter where surgeons were surveyed about which activities were okay after hip replacement. So did everyone agree, or were they kind of all over the map?
It was a mix, actually, a fascinating mix. Some activities, like golf and swimming, got the green light from just about everyone. But when it came to things like jogging, or racket sports, it got heated.
Right. Yeah.
Big debates. So even among experts, there's not always a clear-cut answer.
So no rule book.
Right, no rule book.
That's kind of reassuring in a way.
I think so, too.
It's not like you can do this, but absolutely not that.
Nope. It really highlights how important it is to have those individual assessments and ongoing conversations with your medical team.
It's about what works for you.
Exactly.
Okay, so we've covered a lot on hip replacements.
Yeah.
Let's switch gears to total knee arthroplasty,
Okay.
TKA. What are the key differences between a hip and knee replacement, like in terms of how the implant actually works and just the biomechanics involved?
Yeah, so knee replacements, they're a bit more complex than hips.
Oh, yeah.
The knee's a hinge joint.
It is.
Much greater range of motion. So the design of the implant needs to accommodate that. And initially, the focus was mainly on relieving pain and restoring, basic mobility. But as technology has progressed,
It's gotten better.
we've seen this real shift towards restoring that natural knee movement as closely as possible.
So it's not just about getting rid of the pain anymore.
Right.
It's about how your knee actually moves.
Exactly.
So do different types of knee replacements impact how you can move afterwards?
Yeah, absolutely.
Okay.
The design of the implant, particularly how those components fit together, that can really influence the forces on the joint during different activities. And this is where the biomechanics gets really interesting. The chapter actually goes into some studies. They measured these forces
Okay.
during various activities, and some of the findings were, surprising.
Okay, I'm intrigued. Tell me more. What did they find?
Well, one of the most surprising findings was that downhill walking generated the highest forces on the knee implant.
Downhill walking was worse than jogging.
Even more than jogging, yeah.
I would have thought it was the other way around. Why is that?
Yeah, it seems counterintuitive. But the research suggests that the impact on your heel when you're walking downhill, especially that initial contact, it can create a lot of force on that knee joint.
So it's not just about how much you're moving, but also how you're moving.
You got it. The angle, the impact.
Yeah, the angle, yeah.
All of that matters.
So downhill hiking might need to be replaced with something a little gentler on the knees.
It might. But the good news is
There are other options.
there are lots of other options. And the chapter talks about a study where patients over 70, even with knee replacements, were participating in some pretty high-level activities.
Like what?
Skiing, tennis,
Okay.
even squash.
Wow.
I know, right?
That's pretty intense.
It is, but it's super inspiring.
It is.
It shows that age isn't always a limiting factor when it comes to staying active after knee replacement.
So it's about working with your limitations.
Yeah.
Not being limited by them.
Exactly. And the chapter also talks about another type of knee replacement.
Oh, what's that?
Called unicompartmental knee arthroplasty.
UKA.
UKA.
Is that like a partial replacement?
Exactly. You got it.
Okay.
It's less invasive because it focuses on replacing only the damaged part of the joint, so they preserve more of that natural joint structure.
I see.
It's kind of like getting a targeted repair
Okay, I like that.
instead of a full overhaul.
So if just one part of your knee is worn out,
Right.
UKA goes in and fixes just that spot,
Exactly.
leaving the rest of your knee intact.
Yep.
That sounds great, especially if it means a faster recovery.
It does, and that faster recovery is a big plus for athletes.
Yeah.
Especially those who want to get back to their sport quickly.
Of course.
And the chapter mentions that golfers in particular
Oh yeah, golfers.
seem to benefit from UKA.
Okay, so what do you think? Should we dive deeper into UKA in the next part of our deep dive?
Definitely. There's a lot more to explore there.
Awesome. I'm excited to learn more.
Me too. Before we get into all the UKA specifics,
Yeah.
I think it's important to take a step back and look at the big picture.
Okay.
Because this chapter, it's not just about, the nuts and bolts of the procedures themselves.
Right.
It's also about kind of a mindset shift.
Mindset, yeah.
That, I think, is really important for athletes who are, maybe facing a joint replacement.
Yeah, totally. It's not just about the hardware.
Exactly.
It's the software up here.
Yeah.
The headspace.
Yeah.
And one thing that really stood out to me in the chapter was the discussion about patient expectations.
Oh, for sure.
Because it seems like there could be this disconnect between what people hope to achieve after surgery versus what's actually realistic.
Yeah, that's a really good point, and I wish more people understood that going into this.
Yeah.
It's so important to have open and honest conversations with your surgeon about your activity goals.
Okay, so what are those goals?
Yeah, what do you love doing? What do you dream of getting back to? Lay it all out there.
Be honest.
Be honest, and then your surgeon can help you understand, okay, here are the potential limitations, and here's what's actually realistic for you.
Yeah, so it's like joint replacement is this amazing tool, but it's not magic, right?
Right.
It requires work.
It's from the patient.
100%.
They need to be involved.
Yeah, it's a journey.
It's not just a one and done.
Exactly. This chapter really makes that clear.
Yeah.
It's not just about the surgery itself. It's about, prehabilitation,
Getting ready for it.
getting your body ready beforehand. Then there's rehab after.
Of course.
And then long-term management, making choices to kind of support that joint health for years to come.
It's a process.
It is.
Okay, so speaking of rehab, because I feel like that's where people get intimidated.
I know.
The chapter really emphasizes having a well-structured program.
Yeah.
But it also needs to be tailored, right?
Yeah.
To your needs.
Absolutely. This is where a good physical therapist comes in.
Your new best friend.
Seriously, your best friend.
Yeah.
They can guide you through exercises to strengthen those muscles around the joint,
Okay.
improve your range of motion, and help you regain those functional movement patterns.
So you can feel normal again.
So it's not like you just jump back into your old routine.
Nope.
It's gradual.
It's great.
You ramp things up as you go.
That's right.
If your body's like, okay, we're good.
Your body will tell you.
Yeah, patience is key here.
For sure.
You got to listen to your body.
Listen to your body.
Respect those pain signals.
Yeah, if it hurts, back off a little bit.
Yeah, don't push it too hard too soon.
It's about rebuilding, not rushing.
So one thing that I thought was interesting, and I think this is really important for anyone listening, especially if they're really into sports.
Yeah.
The chapter talks about choosing activities wisely.
Uh-huh.
And it's not just about the impact level, like high impact versus low impact.
Right.
It's also about the specific demands on the joint.
That's such a good point. And this is where things can get tricky.
Okay.
Because, you might have an activity that seems low impact,
Yeah.
but there are certain movements involved that can put a lot of stress on that new joint.
Can you give me an example?
Yeah, so let's say you love yoga.
Okay, yoga.
Yeah. Seems gentle, right?
It does.
But certain poses, especially those requiring a lot of deep bending or twisting, that could actually strain a replaced hip or knee.
Oh, interesting.
Or even golf, which we think of as low impact.
Yeah.
Some of those swing mechanics, if you don't modify them,
Yeah.
they can really stress that joint.
So it's not just about, does this feel okay?
Right.
It's, is this mechanically sound
Exactly.
for that new joint?
You got it.
And that's where, again, having that expert guidance
Yes.
from your surgeon
and your PT.
and your physical therapist is so important.
They can help you figure out which activities are truly a good fit
Yeah.
and how to modify things to reduce the risk.
They're like your pit crew.
I love that analogy.
Yeah, making sure you're running smoothly.
Exactly.
Okay, so we've talked about returning to activity,
Right.
but the chapter also gets into this idea of long-term considerations. Because even though joint replacements are super durable, they're not indestructible.
They're not, unfortunately.
And that's a conversation that needs to happen.
It does, because those high-impact activities, even if you can do them okay at first, over time, they can accelerate wear and tear.
It's like pushing a car too hard.
Exactly. Eventually, something's got to give.
Yeah, you can only redline it for so long.
That's right.
So it's all about balance, right?
It is.
Staying active,
Yes.
but also making sure that joint lasts as long as possible.
Sustainability.
Sustainability, yeah.
That's a great word for it.
The chapter even suggests, as you get further out from surgery,
Yeah.
you might want to transition to some activities that are a little gentler on the joint.
Right. Maybe shifting from those high-impact sports
Yeah.
to something a little lower impact.
Right. Or if you want to keep doing the things you love, just modifying your technique a bit.
Yeah, exactly.
Reduce the stress.
Reduce the stress.
It's like evolving your approach to fitness as you age,
I love that.
right? Working with your body.
Yeah. Not against it.
I think there's a lot of wisdom in that, even for people who haven't had a joint replacement.
Totally agree. It's about adapting and finding joy in movement that works for you.
Mentally and physically.
Yes.
Okay, so we've covered a lot.
We have.
We've talked about, hips and knees, the rehab process,
Long-term stuff.
long-term stuff. Before we jump into UKA,
Yeah.
what are the key takeaways?
The big ones. Okay, so first,
Yeah.
joint replacement, it's life-changing.
It is.
I mean, it can really improve your quality of life, even if you're an athlete.
Even if you're an athlete.
It doesn't mean the end of an active lifestyle.
It's like a new beginning.
Exactly, a new beginning. Second, remember, it's a journey.
It is.
It takes patience, it takes commitment, and it takes a good team.
Your team, your surgeon, your PT.
You're not in this alone.
Teamwork makes the dream work.
Yes, exactly. Okay, third,
Yeah.
choosing activities wisely.
Uh-huh.
Adapting your approach as you age, that's key to making that new joint last. So you can enjoy a lifetime of movement.
Finding that sweet spot.
Yeah,
Pushing yourself,
yeah,
but also respecting your body.
exactly. And then finally,
Yeah.
this field is always changing.
It is.
New technologies, new techniques.
Always something new.
It's exciting, There are more and more possibilities for athletes of all ages.
So stay curious. Stay hopeful.
Absolutely. I think this chapter does a great job of, combining the science
Yeah.
with really practical advice.
Yeah, it's not just a textbook.
It's not. It informs and it empowers.
It totally does. It leaves you feeling pretty optimistic about the future of joint replacement.
Yeah.
Like you can still dream big.
Yeah.
Even if you're facing this surgery, you could still pursue your passions.
Absolutely, 100%.
I love that. It's really inspiring to see how people are defying, those limitations,
Yeah.
getting back to the things they love.
Thanks to these amazing advancements.
It is amazing.
It is.
So it's important to stay informed, ask questions, and advocate for yourself.
I love that. Couldn't agree more.
Okay, I think that's a perfect place to kind of pause for now.
Okay.
We've covered a lot of ground on this deep dive into the world of returning to sport after joint replacement.
Yeah, we have.
Explored some cutting-edge stuff.
Yeah.
Hopefully our listeners are feeling a little more empowered,
I hope so too.
knowledgeable,
Yeah.
and optimistic.
Yeah, it's been a great conversation.
I agree. So now let's talk about UKA. You mentioned this earlier.
Yes, the less invasive option.
Unicompartmental knee arthroplasty.
That's the one.
Okay, so UKA, less invasive, but what does that mean for recovery time,
Right?
especially for getting back to sports?
Yeah, so let's break that down. Yeah, so UKA, it's all about precision.
Precision.
Okay. And a total knee replacement, they resurface the entire joint, right?
Yeah, the whole thing.
But with UKA, it's more targeted.
Okay.
They focus on just the damaged compartment.
I see.
So you preserve more of your natural joint,
That makes sense.
which can make a big difference for recovery.
Yeah, I can see why that would be appealing.
Right. Especially for athletes.
Yeah, less downtime.
Exactly. They want to get back in the game.
Okay, so how does it actually impact recovery? Is it like way faster?
It can be. Yeah.
Okay.
The chapter actually measures a study
Okay.
that looked at recovery times for UKA versus total knee replacement,
Uh-huh.
and the results were pretty impressive.
Okay, what did they find?
People who had UKA got back to their activities much faster.
That's huge.
Yeah, it is.
And what about for golfers?
Oh, yeah. Golfers seem to do really well with UKA.
The chapter mentioned that, yeah.
Yeah. They not only return to golf faster,
Uh-huh.
but they also see improvements in their performance.
Oh, wow, really?
Many of them were back to their pre-surgery level of play within a few months.
That's amazing.
It is.
But I'm guessing it's not for everyone.
You're right. It's not a universal solution.
Okay,
UKA is really best for people with arthritis that's limited to one side of the knee,
okay.
usually the inner side, and they need to have good overall stability in the joint too.
So the rest of the knee needs to be in okay shape.
Exactly. It's not just about fixing the damaged part.
Right.
The rest of the joint has to be able to support that UKA implant.
So it's not for everyone, but for the right person.
Right.
it could be a great option.
Exactly.
So you really need to talk to your surgeon. Know if it's right for you.
Absolutely. They'll assess your situation, look at your age, activity level, the extent of your arthritis.
All that stuff.
All of that, and then guide you towards the best option.
The most personalized approach.
Exactly.
Now, the chapter touched on the long-term outcomes of UKA, especially for people who want to stay active.
Right.
It sounds like we're still learning about that.
We are, yeah.
It's still pretty new.
It is a newer technique.
So more research is needed.
Yeah, we need more long-term data to really understand how it impacts athletic performance and how durable those implants are over time.
Right. But the early results are promising.
They are very promising.
It's exciting to see how much progress is being made in this field.
It is.
Giving people options.
Yeah.
So they don't have to be afraid of joint replacement limiting their lives.
It's not a last resort anymore.
Yeah.
It's a pathway to getting back to doing the things you love.
Reclaiming your life.
Exactly. Of course, it requires, careful thought, realistic expectations, and working closely with your medical team.
That team again?
But the possibilities are exciting.
They are. It's inspiring to see how people are, kind of defying age and those limitations.
Yeah.
Getting back out there.
And it reminds us, how important it is to stay informed.
Yeah.
Ask questions.
Advocate for yourself.
Advocate for yourself. Exactly.
All right. Well, I think that's a perfect place to wrap things up.
Okay.
This deep dive into the world of returning to sport after joint replacement.
Yeah, it's been a fascinating conversation.
It has. So we covered a ton of ground.
We did.
Explored all sorts of cutting edge stuff.
We did.
Hopefully our listeners are feeling a little more knowledgeable.
Yeah.
And empowered.
I hope so.
To, tackle this journey.
It's a journey, but it can be a really positive one.
It can.
So glad we had the chance to chat about all this.
Me too. This has been great. So remember, everyone, knowledge is power.
Yes, it is.
Stay informed.
Absolutely.
Make the best decisions for your health.
I couldn't agree more.
Thanks for joining us on this deep dive.
Yeah, thanks for having me.
And we'll catch you next time for another exciting exploration.